Hello everybody, welcome to this presentation. Today we have the pleasure to host again Mr. Pierre Laurin, who came here for now the third time. So Mr. Laurin will talk to us about why ProMetic has been doing so well and the prospect of ProMetic for the future. We see here that the company, technically speaking, is definitely standing out, and the new entry point, technically speaking, will be on the break of that resistance at 95 cents. So that said, Mr. Laurin, thank you for coming by.
Hello.
Excellent.
Always a pleasure.
Thank you. You just released the financial results recently. Tell us, how do you feel about those earnings? How do you interpret them? Are you bullish on that? Because we know it was a concern sometimes for analysts when they were looking at ProMetic before, way before. But
yeah, you know, in the sector, when you're developing drugs, the life cycle is very different than IT, right? So drugs take a while to get approved, and once they're approved, then they're in for another long cycle. Yeah. We are providing, part of our business is providing enabling technology that becomes embedded in the manufacturing of those drugs. So it takes a little while before those drugs getting approved increase the demand for our products. But now there's a base case of critical mass of those products that have been approved. There's 14 drugs out there that have been approved using our technology, and another 28 or so in development. And that is creating that momentum in terms of, call it short-term revenue, but also with a long-term growth perspective, given that kind of cycle, all right? What's more important is that whilst that base is established and providing good growth prospect as on its own, more importantly, it's enabling us to advance some of our own drugs, all right? So when we partner with the American Red Cross, for example, we've developed this technology to extract valuable therapeutics from plasma, and that we've out-licensed to various parties, which are contributing to our short-term revenue. And over time, we'll be making products for them, manufacturing product for them. But we have selected some, what we call orphan drugs, that we can manufacture ourselves and sell ourselves. So now we're creating a growth engine within our own core competencies.
So if I understand right, the orphan drug status that the PBI 4050 has is one of your biggest assets that you have right now, right?
Well, I'll correct you there, because 4050 doesn't have an orphan drug status right now. I mean, we're looking at different options. PBI 4050 addresses a huge condition called fibrosis, which affects most organs in the body. So we wouldn't be able to get necessarily an orphan drug designation unless you target specific niche indication. We have an orphan drug designation for plasminogen, which is one of the product derived from plasma. We intend to file for other orphan drug designation. But the plant that we are soon going to announce we're opening is going to be manufacturing several of those orphan drugs, all right? So, and each one carry a huge value, right? So it's not uncommon to have a value for each of those orphan drugs that exceeds our market cap, you know, for example. So I mean, so there you are, right? You got a platform that can create several orphan drugs. You have the growth engine right there in Laval.
So at Laval, you're going to build only the platform, right? If I understand right.
Well, in Laval, it's the plant. The plant has been being refurbished. We're only a few weeks away from completing that and turning that into an operating unit, a profit center. You know, a lot of product therefore will be manufactured here and exported, right, worldwide.
But for the PBI 4050, we saw there were good results concerning the clinical results concerning the fibrosis for the heart, for the liver, kidney also. But you're telling me that you have not been approved yet for
no, PBI 4050 will have to go through the typical development phase.
And where are you right now at this phase?
We're at phase 1. All right, phase 1, which is safety, tolerability, and healthy volunteers. We're planning to move into phase 1B2, which is technical term to say that we'll start treating patients. Now, we have amazing results that are most likely translatable to human for chronic kidney disease, diabetic nephropathy. So patients that would have hypertension, diabetes, and that they end up with chronic kidney disease, and those late stage one relying on a dialysis machine to stay alive and wait for a new kidney. These just put things in perspective. These patients alone cost $140 billion to Medicare in the U.S. You realize the scale of things. So if you can bring a drug forward that actually delay the need for a dialysis, okay, reverse the condition even, let's hope, but just delay the need for dialysis. It's a huge impact, not just on the quality of life of those patients, but cost-wise, the system gains. So value for drugs like that is insane, right?
Okay.
I mean, it's simply huge.
Because the thing is, I'm trying to understand. You say PBI 4050 has not yet has the orphan status drug,
Yes.
but in the recent the last interview you gave us,
Yes.
There was a news release that said that there was one drug that had the orphan status.
That's plasminogen.
Plasminogen. And is it Imatec who's going to produce that, or is it?
Imatec is in partnership with us. Imatec is funding the development of plasminogen,
Okay.
right? And we're going to manufacture plasminogen, commercialize globally, and we share on the net profit with Imatec, which is
Okay.
a Taiwanese-based company. PBI 4050 is not partnered yet.
Okay.
It's a small molecule. This one is not derived from plasma. It's a small molecule that
Okay.
was developed by our R&D folks in Laval. And that product, you know, could gain some orphan drug designation if we focus on conditions such as pulmonary fibrosis.
PBI 4050.
PBI
right?
4050. We've presented data at a respiratory conference in Barcelona where we show that our drug really performed very well. And this is, I mean, people may know of pulmonary fibrosis. It's an amazing, deadly condition. It's the survival rate for those who are diagnosed with this is almost as bad news as pancreatic cancer. Okay, so survival rate, 5-year survival rate is not very high.
Okay.
It's called idiopathic pulmonary fibrosis, which means we really don't know why people develop this. Okay, the problem though is that they lose the functionality of their lung because the lung becomes scarred with fibrotic material. So we've tested our compound against what is approved for use in human, and we compare very favorably, and the combination of that does even better. So there's pressure to go in such orphan indication, but we also have amazing results in, as I mentioned before, diabetic kidney disease, chronic kidney disease, and now, recently at the American Society of Nephrology, we showed data that we reduce fibrosis in the heart.
Yeah.
So now, getting in the heart, you have congestive heart failure. And I don't want people to get confused here that we have the miracle pill that cures everything. That's not the point. Fibrosis is a mechanism by which we heal. Too much of it is never good, like anything else.
Okay.
And if you have a scar on your hand, okay, it's aesthetic. But if you have a scar in the wrong place in your heart, then you may have arrhythmia, congestive heart failure. If your lung or kidney becomes scarred all the time, then you lose functionality. And that means death, you know, or accelerated illness that is not good. So it's got to be an interesting decision tree for us in the coming weeks with our advisors and consultants, sitting down with the regulatory agencies as well to say, okay, what is the best regulatory pathway to get the product approved?
Yeah.
It may not necessarily that you have to go for the big indication. You may have to choose for indication that gets you there faster and then roll back into another indication. But that is only one of the several projects that we're pushing forward, right? But that's a huge one. It's a huge asset.
Talking of the projects, because what I remember from what you said from the last interviews is that you guys are not necessarily looking for the home run, but you guys are looking for some stable sources of revenue with a drug that can cure some disease. So what are the other products that you have on your pipeline that you're working on? And
Well, it's a good question. In fact, I like your analogy of baseball, right? You can win games with bunts and singles. And we're winning that game because with bunts and singles, and just like last week was it, we had a purchase order for $5 million for resins, right, for filters with one of our clients. Some of our clients like Octapharma, demand for filters this year will exceed 7 million. Next year will probably be around 10 million. Those type of revenues are growing, solidifying the base of our company, and will advance other assets like that will generate the $20 to $30 million revenue, and that's fine. That is the base case that reassures everyone that ProMetic is not an all or nothing story. All right, it's not just blue sky. So there's growth there, but then there's some breakaway stars, right? That if they do pan out, then it's the log growth in a year, right?
Okay.
So but having the base now funded, well capitalized, the manufacturing platform done, you can see that we're putting all the piece of the puzzle, right?
Yeah.
And it's now no longer a juggling, Chinese juggling thing. The plates are all lined up and we're ready to go for dinner.
All right. Now, talking
La table est mise in French, we say.
There's one question from a viewer here. One was asking, like, when will the trial report of the PBI 40 will be released? Trial results.
Well, I mean, I think by mid Q1 next year, okay. And then we'll announce at the same time which indication we have decided to favor in terms of kickstarting the study. We're planning to have at least 4 or 5 INDs. Okay. INDs is an investigational new drug submission. That means that the FDA or Health Canada or Europeans allow you to move into the clinical trials.
Okay.
So about the same time next year, we'll have 4 or 5 products in the pipeline already in clinical.
Okay.
And that increases very much the profile of the company. So you have revenue, you have assets moving into that program.
But they'll have to go through the different agencies separately.
They're all different. Each country has its own agency. FDA in the US, as you know.
Okay. Yeah. Excellent. Now, 2 last questions here. Talking of the partnership you have with Ematec, they will be a subcontractor of ProMetic, is that correct?
Oh, that's a very important point.
But they also give you some revenue too.
The point is that, you know, in Laval we'll have a capacity of about 150,000 liter of plasma, which is a small plant compared to a plant that Baxter will have. Okay. However, the plant in Laval will be destined to manufacture only high-value products, so low-volume, high-value products. So we'll almost be a typical output of a biotech-like high margin. Ematec, on the other side, is willing to invest over $100 million, right, to build a plant that will be a copycat of Laval, but at bigger scale.
Okay.
And will act as a custom manufacturing for us and our clients. So all of a sudden we have a lot of off-balance sheet events here happening. Okay. You have a huge capex investment being made over there to manufacture, so it increases our overall capacity, but none of that shows on our balance sheet.
Okay.
Laval is a lease agreement that we have with INRS, which is a university. Fantastic institutions that have supported us all the way. It's not on our balance sheet. That plant is about $50 million, 3 years to put in place. And it's because it's a lease agreement, it's not on a balance sheet. So there's a lot of things here that are being leveraged to create far more value than meets the eye if you just look at the balance sheet. But at least now we have a good cash position. We raised 24 million. Just a few weeks ago, we had the 10 million loan agreement with Tom Vest. So ProMetic is in one of its best time ever cash position, and with revenue growing. So it's a good combination, as I said, you know, good timing.
Excellent. Now, talking of a viewer who has been looking at your company, looking at your story for the last few years, because we have been, it's not the first time you're coming here, what would you tell him to convince him that ProMetic is the investment that she should hold in his portfolio? Because technically speaking, your stock is doing pretty great, but fundamentally speaking, how would you convince an investor who's looking at you right now?
Well, you know, I think that there's a lot of advantage if one actually reads carefully on what we've been executing here. Putting the piece of the puzzle is part of the recipe. The revenue that helps fund that activity, and what it enables the company to do and how it enables it to grow. You'll have to look down south because there's more example of companies that have done extremely well in the rare disease space, and then as a comparator, look at what ProMetic can do. We can do 5 to 10 orphan drug-like product in our Laval facility. So immediately you can see that, you know, we're far from achieving maximizing our growth right now. I mean, any CEO of a company would probably tell you that, but the facts and the fundamentals are that the platform we put together is there to demonstrate it.
Excellent. So we'll look forward to hear back from you again, Mr. Laurin.
Thank you very much. Look forward to it.
Thank you.
Thank you.